Hello, this is Dr. Gary Bellman, and I'd like to give a quick video about injecting testosterone, injecting HCG. How does injecting work? Well, this is a vial of testosterone, and testosterone cypionate, which is commonly used, is viscous, meaning it's thick. And therefore, an injection once or twice a week can stay in the body and slowly give off testosterone. Injections are actually a little feared. Most men will take and can learn to do injections. So when we do injections, simply put, we take a syringe. There's the injection syringe, and we have two types of needles. We have a bigger needle and a smaller needle. So simply put, we want to drop the testosterone with a bigger needle, and then when we want to inject, we use a smaller needle. The gauges or the size of the needles are counterintuitive, meaning a bigger number is a smaller needle. So we often use an 18 gauge needle, which is a bigger needle to draw up the testosterone, and we use a smaller needle, a 25 gauge needle, to inject the testosterone because it hurts less. So specifically when we want to inject, we take a 3 cc syringe typically, and then we take the vial of testosterone. We're always cleaning the testosterone with an alcohol swab. Then we take the needle, bigger needle, we place it into the testosterone, and then we draw up testosterone. And we're drawing up the testosterone to the bevel. And here we're seeing a 1 cc. That's a good sized dose. This is a half cc. A common dose is 3/4 of a cc. And then once we have the medicine in the needle, then we'll put the vial down. We'll take the bigger, the 18 gauge needle off, and then we have the medicine. And now we have the medicine, we want to put on the small needle. Now we tighten it, and this is ready to inject. Testosterone can be injected into a leg or a thigh, behind, or even some men inject to a shoulder. We typically inject in a muscle. Can it be injected subcutaneously? Yes, it can. So basically, it's pretty simple. The testosterone is drawn up. Needles hurt, so there are little veins and nerves coursing throughout our body. So I usually tell men, if you're gonna choose a little spot on your leg or behind, touch it first with the needle. If it's hypersensitive, nerve might be there, and then you do an injection. Alternatively, we have men who give themselves HCG as well. This is a tuberculin syringe, a much smaller one. The HCG is water-like, therefore we don't have to go through the bigger needle, smaller needle issue. And we draw up, this is 0.5 or 0.6 cc's. And that's injections. Now, there are men who say, Doc, I'm not doing any injections, but I want better testosterone. Then we talk more about testosterone bioidentical pellets. We do also have testosterone creams. Majority of men can learn to do this, but there are other options. I hope this simply demystifies the whole testosterone injection process. Thank you very much.